Welcome to Active Living at the Active Life. Today's program is a vital program. I hope you're able to sit down and listen to it in its entirety. We're focusing on fall prevention. 1 in 3 older adults fall each year. Many injure themselves and have debilitating injuries that prevent them from doing those things they want to do. We've invited specialists today to help guide us in ways to prevent an older adult from falling. So stay tuned. We're here at the Medicine Cabinet on Vernon Street. We're going to visit inside in just a moment, but you don't want to miss a moment. I'm here today with Vicki Williamson. She's a physical therapist with West Georgia Home Care. Thank you, Vicki, for being with us, and tell me a little bit about yourself. How long have you been a physical therapist?
Thank you for having me, Dan. I have been a physical therapist for about 16 and a half years. I worked with the hospital until 2004, and then I transferred to the home care division and have been there ever since.
Wow. Now, what is your role, or describe a little bit what you do as a physical therapist?
In the home setting, as a physical therapist, we go in and we evaluate the patient's ability to move around the home. We evaluate the safety of the home. We make suggestions about improving the safety of the home, including falls precautions and any obstacles that might be in the way. We discuss how to rearrange their home to suit their new found mobility problem. We also work with them on strengthening whatever weaknesses they have to improve their mobility.
What kind of training is required to be a physical therapist?
Well, when I did my training 16 and a half years ago, it was a bachelor's degree, but since then they have increased the requirements, and it is now a doctoral degree. So anybody coming out of physical therapy school now is considered a doctor of physical therapy.
Okay. Now, our focus today is on fall prevention. And so there are 2 areas of fall prevention that I think you're uniquely qualified and expert in the field of to help prevent older adults from falling. The first one I want us to focus in on is exercise.
Yes.
Exercise, is that a key component of a physical therapist teaching exercises to your patients?
Yes, sir. That is exactly what we do. I, as the therapist, go in and determine which muscles are weak, what is causing an imbalance, what needs to be strengthened, and then we determine from those findings in the evaluation what muscles and what exercises we need to focus on.
Okay. Is exercise a preventative measure for falls? In other words, can a person that exercise, the more exercise a person does, will that help prevent falls?
The better condition your muscles are in is definitely a component of your balance. The more you use your balance, the more you use your muscles, the better your balance is going to be. When people begin to lose their length of step and when they start to lose their speed when they walk, those are 2 things that can create one of the biggest balance hazards. And people begin then to need walkers and canes and crutches and that sort of thing.
Are there specific exercises a person could do, an older adult, that would help improve their balance?
Yes, there are several that you can do. Most of the ones I do, I generally have my patients hold on to a sink or a countertop, something that's attached that will not move if they need to hold and grab. We do lifting your heels off the floor and lifting your toes off the floor. The muscles in the front and the back of your calf and shin are muscles that are used significantly if you start to lose your balance backwards. They help to pull you forward so that you don't actually get your center of gravity outside of your base.
How often should someone do those exercises if they want to improve their balance?
I actually, in the intensive therapy first 2 or 3 weeks, we ask them to do them 3 times a day. Probably 20 to 25 repetitions of each one.
Oh, that's great. I know here at the Active Life we have free fitness classes that involve exercises as you're describing.
Yes.
And I hope that we have some of our older adults that will come and participate here in that, because fall prevention is very important to us. There's nothing worse than hearing that one of our older adults has fallen, and especially if there are serious injuries associated with that.
Yes, sir. I see quite often a large number of older adults who have either fallen and broken a bone or have broken their hip and fallen. So some of the prevention would be also to strengthen your bones, and exercise and standing and weight bearing also help to prevent bone loss.
Okay. The second dimension that you just mentioned, that part of your job description is that you go in the home and identify obstacles
Yes.
that could be a problem with mobility. What are some typical dangerous trip hazards that you run into in a person's home that people need to be aware of that could help prevent them from falling while they're at home?
There are 3 major ones that I usually run into. There are the electrical cords that are not out of the path that people travel most often. There are pets, very excitable dogs or cats that like to weave in and out of your feet. And there are also blocked doorways or narrow passages that can be a problem as well. The dogs, cats, rabbits, pigs, ferrets, whatever you have in your house, a lot of times are very enthusiastic when a patient has come home. They haven't seen them in a while. So when they're walking, the dog or the cat will jump up on them and cause them to lose their balance or create pain or something that, so we ask that in the time frame that their balance is under construction, that they have their pets restrained in some way so that they don't get knocked down.
You see many pigs and ferrets here in Troup County? Maybe I don't want to know.
Well, I have seen a pig in the home, and it was a lot of fun. I really enjoyed the pig in the home. I haven't really seen a ferret so much in the home of my patient. My stepson's roommate in college had one of those, and it was definitely a trip hazard. Rabbits. We see a few rabbits, and those are fun as well.
What about electrical cords? Is that a trip hazard you see in the home?
Oh yes, electrical cords and oxygen cords. A lot of the patients who have to wear oxygen 24/7 or who wear it at night, who have to get up to go to the bathroom in the middle of the night, those are trip hazards. And especially if the patient's mind is not always in the present moment, they can be a problem. And sometimes what we'll do with the oxygen cords is just put cup hooks in the walls and let them hang the cord on the cup hooks as they go somewhere, and then as they come back they take it off. So it keeps it out of the floor. We also have electrical cords. We ask that you take them down or move them out of the way completely. We also have rugs, especially rugs in the bathroom that match the decor, and everybody likes their rugs because the floors are cold in the wintertime and so forth. But we ask that you pull those up, and again, while your balance is under construction. Okay,
that's very good advice. Okay, so to summarize, if people are listening, they have an older adult that's in their family they're concerned about, what is the top 3 things a person can do if they're concerned about balance issues that they can improve in the area of exercise and the area of making their home safer?
There are 3 or 4 exercises that you can do on a daily basis. The standing, like I said, coming up on your toes, coming up on your heels, kicking out to the side, stepping out to the side, kicking back and stepping back. There are checklists to go through in your home. Pull your rugs up, tape your electrical cords down. If you have narrow passages, a lot of people have that piece of furniture has been sitting in that place for 60 years and I don't want to move it, but they cannot get their walker past it, and that's usually where they fall. So we might have to let go of some of the placement of our furniture, make sure we clean our pathways out, tape down our cords, move our cords, pull up our rugs.
Wow, that is great. Well, thank you, Vicki, for taking time to talk with us. We're glad you're in our community.
Thank you very much.
And wish you the best.
Appreciate that.
I'm holding an all-fruit smoothie in my hands made in our brand new wellness snack bar. Celeste Garrett is with me. She is our wellness coordinator here at the Active Life, and she is doing wonderful things to make a difference in people's health and wellness. And so, Celeste, glad you're here today.
It's nice to be here. And you know, the Wellness Center is just hopping this time of the year because of everybody in their New Year's resolutions. You know, they're back and going. So we have opened a wellness health bar. We're serving blueberry juice, fresh 100%, no sugar, yogurt, granola bars, and today, smoothies. So we are just so excited about this, and we have wonderful classes here. We have aerobic classes. We have intermediate, low impact, stretch. We do dance fitness, we do square dancing, we do line dancing, we do Tai Chi, and you can go work on the fitness machine. So whatever you want to do, we've got it here for you.
Wow. So if somebody wants to make a difference, get healthier, get well, they're tired of being sick and weak, and they want to, just prevent falls and continue to make a difference in their community, they can come here. They could see you, see me, and we'll help introduce them to the different classes that we have here. Most of them are free.
They are free. And, you know, the good thing is we have one-on-one consultations for those with chronic diseases, nutritional planning. We have 2 classes with just general classes for healthy eating. And then we have a 90-day weight management class that just started. And that class is continuing to grow. We have proven that you can lose 20 to 25 pounds taking this class. So we're doing great over here.
That's wonderful. I hope people take advantage of this. This is free to anybody 55 and older.
It is,
We do have a couple of classes that have a small fee, but for the most part, most of our classes are free.
Right.
And they do wonderful things. In fact, our snack bar, you can even earn points for free items at the snack bar by participating in these classes.
You can you earn 24 points, which you get points for every minute of exercise that you do. And then when you earn 24 points, you turn it in and you can get a delicious healthy snack available to you 2 days a week on Tuesdays and Thursdays.
Wow. So I think it's like 1 point for every 15 minutes.
15, I'm sorry.
Okay. Well, come on out to the Active Life. Get active. We want you to stay healthy and to live long. Dr. Anna Cowell is a physician at the Emory Clark Holder Clinic. She's an ophthalmologist. Did I get that right?
Yes, sir.
And she's going to talk with us a little bit about how vision impacts falls. But before we do that, optometrist, tell me a little bit about that. What is the difference?
Sure. I'm an ophthalmologist. What that means is I'm a medical doctor, but I specialize in eyes. So what that means is my training includes going through medical school as any family practice doctor, internal medicine doctor. Then I specialize 4 more years into particularly the disease process and surgical care of eyes as well. And optometrists, usually they deal with more healthy eyes. They don't go to medical school, they go to an optometric school. And that usually involves 4 years of training or school for them, and that's strictly it, versus we go through 4 years of medical school, after 4 years of college, and then 4 more years of residency training after that. And then after that, there's also subspecialists on top of that, such as retina specialists, glaucoma specialists, pediatric strabismus specialists.
Now, do both you and optometrists prescribe eyeglasses?
We do,
Okay.
because that's mostly in the healthy, what we call preventive care or corrective care.
Okay.
But in terms of for ophthalmologists, where medical doctors were involved into more disease process and also in the surgical care, actual surgery part of
Okay.
eye care.
Okay, well, let's first look at what are some issues or diseases of the eye that could possibly cause an older adult to fall.
So, as we know, the aging process, or what I like to tell my patients, their birthday process involves a lot with vision. As we get more birthdays, naturally, eyes are part of the extension of the brain, can deteriorate. And eyes have many parts to it, and different parts can deteriorate for many reasons. I have spoke many seminars before. If we go from externally or from outside to inside, basically many reasons can cause vision to continue to deteriorate, which is one of the major risk factors of falling. So when we look at a person who's aging, one thing that I also notice is, first of all, their eyelids. Sometimes over time, their eyelids can sag and actually can decrease their peripheral vision. And that's a gradual process a lot of people don't notice. And then they can have, next thing is basically they can have dry eye conditions, which make their eyes not able to focus long period of time. But that's usually more of a fine vision. And as we continue to go further back, there are conditions such as cataracts. Cataracts is a condition that comes with birthday process as well, and usually is such a slow onset. What that means is it's such a gradual process that some people may not notice their vision have deteriorated until it's a whole lot later. So initially, for a very active person, it could be nighttime trouble driving where they can notice glare and halos, but most of people, it's a slow process where they may notice having small prints trouble and noticing they need brighter lights. And some of the things I have noticed in some of my elderly patients, they can have trouble ambulating or moving around in places that's not as well lit. And I hear cases where if they're out walking their pets, their dogs in the morning, and then they don't see as well when it's just about to turn bright. And that's where they can not see the uneven pavement or steps and therefore fall because of that reason.
Wow. Well, let's talk prevention. An older adult, how can they best take care of their vision to help prevent some of these falls?
So some of the guidelines that's been out there, especially for most of us, a regular, routine, comprehensive eye checkup is necessary.
How often?
Well, for people in the earlier ages, it's not as routinely in people who are healthy. But unfortunately, many eye disease comes on as we get more birthdays. So I think a CDC recommends somewhere between 60 to 65 starting every 2 years.
Okay.
However, for somebody who's diabetic, which is the top cause of vision loss or blindness for people under age 65 in the United States, that's a recommendation that's been suggested once a year.
Okay.
Because diabetic retinopathy or diabetic changes in the eyes can happen so slowly and people may not notice until it's a whole lot later. So yes, after I said somewhere between 60 to 65 for sure. If it's otherwise healthy, every 2 years or maybe at least once a year may be a good idea as well.
All right. Eyeglasses, how often should they receive new eyeglasses? Or you see a lot of older adults that wear their eyeglasses way too long and they needed to have it updated?
So I think of eyeglasses, it's almost like, I guess it's like driving a car. So some people, when they go get their eyes examined, their vision hasn't changed. And I think that doesn't mean they have to have eyeglasses changed, even if it's been 2 years or 3 years. However, what's important is when they have their eyes examined, and they go through a full exam where their eyes are dilated, where their vision acuity is assessed. And that's important. And so not just do we assess that, a lot of time when they come in to see me in my office, there's more than just checking their vision. We also test for their side vision as well.
Okay.
Because there are times that I see elderly patients that may had a stroke and they're not aware of it.
Oh.
And therefore they have already lost part of their peripheral vision, which is probably more important in terms of getting around, making sure they're seeing their sides. And
Okay.
so more than just being able to see straight ahead, sometimes it's important to have a good eye exam where they are being checked for their peripheral vision as well.
Okay.
Because there are other conditions such as glaucoma that can damage a person's peripheral vision and therefore causing them not be able to move around, and therefore it's the part of the reason falling. And that
Wow.
may not be something they can detect because it may not be painful.
Well, Dr. Cow, I hope that some of the people listening will take your advice and get their eyes checked.
Yes,
And
definitely.
not put that off because they could end up falling and injuring themselves when it could
Right.
be something preventable if they had the proper
Absolutely.
treatment.
Absolutely.
Well, thank you for all that you do for our community, and thank you for
Absolutely.
taking
It's my
time
pleasure.
with us.
Thank you.
I'm here at the Medicine Cabinet on Vernon Street with Josh Seward. He is a pharmacist here. And Josh, we're going to need some guidance in the area of fall prevention and how pharmaceutical items, prescriptions can impact an older adult's sense of balance and all. How long have you been a pharmacist?
13 years.
Okay.
Yes,
And how long have you been with the Medicine
Cabinet just about 6 months. Before that, I was here local with Walmart for a little over right at 10 years here in LaGrange.
Okay. Josh, what should older adults know about prescriptions and medications as it relates to balance?
The biggest thing I would think of, just pops in my head first of all, would be sleeping pills. And a lot of people don't think about, they come in that a lot of elderly have trouble sleeping. We all know that. And a lot of them will come in and want a Tylenol PM or Benadryl to help them sleep. As our body ages, we don't metabolize that quite as well, so some of the people, and then we have to get up in the middle of the night and use the bathroom, so they can be a little in the haze at night, unfamiliar, in dark. And that would be probably my biggest thing I would say is watch some of the over-the-counter and prescription sleeping pills. We get up in the middle of the night, we're not in the haze, we're familiar with the house, but we just don't, we're not quite right and worry about slipping and falling that way. The second thing would be prescription items, obviously mixing them with alcohol. Even a glass of wine sometimes can really add to a pain pill or something, and getting up in the middle of the night would be the biggest thing. Of course, even during the day, you could take a pain pill during the day, go to lunch, maybe have a glass of wine or something, and just not be themselves. Elderly obviously are more risk, and if you add any type of narcotic, any type of pain pill, nerve pill, sleeping pill can really is one of the biggest things that I worry about.
What should an individual do if they're concerned that their medication is causing them to feel dizzy? Should they talk to their pharmacist? Should they talk to their doctor? What should
Probably
they do?
all of the above. I
Okay.
would probably, of course, pharmacist is the most accessible. I would probably talk to him or her and get some type of direction. Of course, we always have to note back to what the doctor really wants, but we can usually give a good idea that, hey, maybe this medicine mixed with this medicine is probably not a good thing at your age, and especially if they're a little feeble or something like that. And that would be the first line of defense. And before we stop any medication or start anything, we definitely need to talk to the doc. But a pharmacist is always a good idea, just to kind of give you a rough, and we're very accessible. Pick up the phone, you can talk to us in just a minute or two. That's the best thing.
What is the danger of an individual getting the prescriptions from multiple places versus one? Tell me about that.
Because when Miss Smith comes in here and she gets it only from me, usually I know Miss Smith, and I know if she has a sleeping pill that maybe the ER had written for a week before, or a pain pill, and I can make sure that they don't interact, or I can say, hey, Miss Smith, you got a pain pill last week. Let's make sure we don't mix that with this other pain pill that the dentist gave you because you had a tooth pulled or anything like that. Obviously, when we're going to different pharmacies, that it's unbeknownst to me to another medication that we might be taking, and of course it increases that chance to fall.
Okay. Any other advice that you would give to older adults relating to their prescriptions? You've given some very valuable tips to avoid certain situations that could cause them to feel dizzy
If-
and all that.
The biggest thing I would say is just ask. Don't be afraid. If you have a question, that's what we're here for. Pick up the phone and call us. Maybe busy for a second, may say, hey, we have to call you back, but just ask. And if you feel anything that's a little bit different, no matter what, especially when a doctor starts a new medication, it doesn't even have to be a narcotic or a sleep pill. It could be as simple as a new blood pressure pill, and you feel a little lightheaded and you can fall. So anything like that, if you're feeling anything, pick up the phone, call the pharmacist, and then we can even call the doctor for you. But anytime you start a new medication and you're not feeling exactly right, pick up the phone and call us. And like you reiterated before, keep everything at one pharmacy. Be it, I love you to be at the medicine cabinet, but if not, wherever you're at, to keep them at one so that one pharmacist can look after you.
Excellent advice. Thank you, Josh,
Thank you.
for your feedback. And I'd like to thank you all for joining us today. I hope this information will be valuable to you, and we want less older adults to fall. Have a wonderful day.